السلام عليكم ورحمة الله وبركاته طلبة المرحلة الثالثة. اليوم حنبدي Mandibular Anesthesia أو Mandibular Nerve Block. شنو هي التكنيكس اللي ممكن نستعملها حتى ممكن نسوي تخدير للفك الأسفل. Actually, there are 6 nerve blocks are described. 2 of these involving the mental and buccal nerves provide regional anesthesia to the soft tissue only and have exceedingly high success rates. In both instances, the nerve anesthetized lies directly beneath the soft tissue and not encased in bone. اللي هو المنتل يخرج من المنتل foramen واللونج buccal ينزل along الميديال pterygoid وبعدين يكون on the buccal vestibule of the mandible. The 4 remaining blocks طبعا هذول يعني المنتل واللونج buccal directly underneath soft tissue. أما ال other 4 remaining blocks اللي inferior alveolar nerve والincisive الجوجيتس ماندبل والفيزيراني أكينوزي فازيراني كلها for mandibular nerve block and will provide regional anesthesia to pulps and some of the old mandibular teeth in the quadrant. 3 other injections of importance in mandibular anesthesia the periodontal ligament حنتعرف عليها والintraosseous والintraseptal will be described. Although these supplemental techniques can be used successfully in maxilla and mandible, and their greatest utility lies in the mandible, because in the mandible they can provide pulpal anesthesia of a single tooth without providing the accompanying lingual and facial soft tissue. Anesthesia occurs with other mandibular as anesthesia occurs with other mandibular nerve block techniques. التكنيك اللي نقدر نستعملها for mandibular nerve block or for mandibular anesthesia in general, infiltration may be considered a first of choice in injection depending on the age of the patient and the tooth of interest. At age of patient, mandibular infiltration is successful in cases where the patient has full primary dentition. Once a mixed dentition develops, it is a general rule of teaching that the mandibular cortical plate of bone has thickened to the degree that infiltration might not be effective, leading to the recommendation that mandibular block technique should be now employed. So after من نوصل إلى الميكس dentition stage فما فوق بالحالة we have to be away from the infiltration technique for the mandibular jaw. The technique is similar to that described for the maxillary buccal infiltration, and in the lower jaw the area of penetration is made taut by pulling the tissue laterally and inferiorly rather than superiorly. The point of penetration is in the depth of the buccal sulcus, and the technique is identical to the maxillary buccal infiltration. A 30 gauge needle is used, and 1 milliliter of solution is so enough in order to produce infiltration. فإذا احنا قلنا الأيج الميكس دنتيشن فما فوق الأفضل ما نستعمل الانفلتريشن تكنيك. The tooth of interest in adults, infiltration anesthesia is the first of choice for pulpal anesthesia of the lower incisor teeth. ليش؟ لأن عندها thin porous buccal plate and contralateral inferior alveolar nerve يعبر اليسار إلى اليمين واليمين إلى اليسار بالأنستيزيا. Pulpal anesthesia is best achieved by depositing solution, both buccally and lingually, in the apical region of the tooth involved. A volume of at least 0.5 milliliter at each site is recommended. The buccal injection البكال injection نفس الطريقة نسوي touch للsoft tissue and we insert the injection in the depth of the sulcus. The onset of anesthesia may take longer than the maxillary buccal infiltration. It may be last for 8 to 10 minutes before the pulpal anesthesia is of sufficient depth to allow pain-free operative procedure on the tooth. طبعا أيضا we can give in the lingual side of the teeth in order to confirm infiltration anesthesia. Regional block methods in the mandible. Most of dental treatment on the adult dentition that requires anesthesia is performed using regional block methods. And as with the maxilla, there are extraoral approaches to the mandibular nerve, and these are not recommended in the dental practice. Regional block methods used in the mandible including inferior alveolar and lingual nerve block, Go-Gates block, Akinosi-Vazirani, long buccal nerve block, mylohyoid nerve block, and incisive and mental nerves block. نبدي بأول واحد وأهم واحد هو the inferior alveolar and lingual nerve block. Is the second most frequently used after infiltration. The aim of injection is to deposit local anesthetic solution close to the mandibular foramen on the medial aspect of mandibular ramus, thus blocking transmission in the inferior alveolar nerve at the point of entry into bone. إذن الهدف وين لازم أني أنزل الانجكشن قريب إلى المانديبولار foramen in order to make anesthesia for the inferior alveolar nerve as it enters into the bone canal. Positive aspiration حدود من 10 إلى 15%, the highest of all intraoral injection technique. Nerves anesthetized. Inferior alveolar nerve, branch of posterior division of the mandibular nerve of the trigeminal, والincisive, والmental, والlingual commonly associated with. فإذا هاي هي الاريا of anesthesia. The whole molar teeth, نص الفك تقريبا أني أقدر أعطيلها anesthesia by the inferior alveolar nerve block. areas anesthetized اللي هي mandibular teeth to the midline, the body of mandible, inferior portion of ramus, buccal mucoperiosteum, mucous membrane, anterior to mental foramen, while anterior 2/3 of the tongue, floor of the olar cavity by the lingual nerve, and lingual soft tissues and periosteum also by the lingual nerve. Administration of bilateral inferior alveolar nerve blocks is rarely indicated in dental treatment, other than bilateral mandibular surgeries. They produce considerable discomfort, primarily from the lingual soft tissue anesthesia, which usually persists for several hours after injection, and the patient feels unable to swallow because the absence of all sensations is more likely to self-injure the anesthetized soft tissue. أنا حقيقة ما أفضل إنه نعطي بايلاترال أنستيزيا لين يطفى الشعور للمراجع كأنه مخنوق، فلذلك أتجنبها. أعطي بايلاترال انفلتريشن للماكزيلا ما عندي إشكال، لكن اللور جو لا. عادة أعطي إما inferior يعني nerve block on one side وأعطي مثلا mental infiltration on the other side. المهم ما أسوي 2 blocks for the lower jaw. Two excellent alternatives to bilateral inferior alveolar nerve blocks are bilateral incisive nerve block, where the lingual soft tissue anesthesia is not necessary, unilateral inferior alveolar nerve block on side that has the greater number of teeth requiring restoration, or that requires the greater degree of lingual intervention, combined with incisive nerve block on the opposite side. نفس الكلام اللي ذكرته قبل لحظات. The success rate of inferior nerve block is considerably lower than that of the most other nerve block. Difficulty with the traditional holistic approach. هذا inferior alveolar nerve block target مالتنا الماندبلر nerve يسموها holistic approach is the absence of consistent intraoral landmarks. هي هاي النقطة لذلك يصير failure نوبات. انه احنا نعطي الانجكشن بطريقة by estimation بطريقة تقديرية نزرق الأوبرا. Failure rates for inferior alveolar nerve block are commonly high, ranging from 31% up to 41% in mandibular second and first molars, up to 42, 38, up to 42%, and 38, 46% in the second, first premolars and canines, respectively, and 81% for the lateral incisor. كل ما نتقدم anteriorly نوبات failure of anesthesia تزداد. The central core theory best explains this problem, that the nerves on the outside of the nerve bundle supplying the molar teeth, while the nerves on the inside core of fibers supply incisor teeth. Therefore, the local anesthetic solution deposited near the inferior alveolar nerve may diffuse and block the outermost fibers, but not those located more centrally, leading to incomplete mandibular anesthesia. بمعنى انه التخدير يكون على الخارج اكثر، يعني نتخيل هذا النيرف فد واير، فالتخدير حيجي على الاوترموست nerve fibers not to the central core nerve fibers، وبالتالي وبما انه السنترال كور هو اللي يتقدم anteriorly، بالتالي يصير عندنا failure or weak anesthesia for anterior mandibular teeth. طبعا هذا الانفيريور الفيولار نيرف بلوك اللي هو الهدف مالته الماندبلر فورامن بطريقتين، دايركت تكنيك اللي نسميها هالستيك تكنيك or holistic approach والindirect technique. A direct technique, this method is also known as holistic approach and relies on simple anatomical landmarks. The aim is to deposit the local anesthetic in a pterygomandibular space, the target area inferior alveolar nerve, as it passes downward toward the mandibular foramen but before it enters into the foramen. This anatomical space is bordered posteriorly by the parotid gland, laterally by the ramus of mandible, medially and inferiorly by the medial pterygoid muscle, superiorly by the lateral pterygoid muscle, and anteriorly by the buccinator muscle. وكما هو واضح بهاي الصورة. هنا عندنا الريمس وهاي الماسيتر medial pterygoid muscle، وهنا الهدف مالتنا هو inferior alveolar nerve as it enters the mandibular foramen. The position of the foramen is variable. It should be noted that mandibular foramen is usually apparent on dental panoramic radiograph, and if one of these available, it should be consulted. Information regarding the height in relation to teeth and the anterior-posterior position of foramen will be obtained from the radiograph. طبعا المشكلة مو كل واحد عنده الاو بي جي، وهي ايضا مو عملية انه انت تدز المراجع والله خذ لي صورة او بي جي حتى اوجد وين الماندبلر فورامن. لكن عندنا وسائل وطرق شلون we can estimate the position of mandibular foramen. فأنا بهالحالة أدور على لاند ماركس. شنو هي اللاند ماركس؟ الكورونويد نوتش, the greatest concavity on the anterior border of ramus, pterygomandibular raphe, vertical portion اللي هي pterygomandibular raphe, والocclusal plane of mandibular posterior teeth, occlusal plane of mandibular posterior teeth. هاي الثلاث نقاط إذا واحد ضبطها تنضبط الانجكشن. Orientation of the needle bevel less critical than other nerve blocks because the needle approaches the inferior alveolar nerve at roughly at right angle. فنحط ببالنا الكورونويد نوتش هاي لاند مارك مهمة. pterygomandibular raphe, شنو هي pterygomandibular raphe؟ هذا سؤال لكم. والocclusal plane of the posterior mandibular teeth. mandibular posterior teeth. زين. Three parameters must be considered during administration of inferior alveolar nerve block. The height of injection, the anterior-posterior placement of needle, which helps locate a precise needle entry point, the depth of penetration, which determines the location of the mandibular alveolar nerve. The height of injection. Place the index finger or the thumb of your left hand in the coronoid notch. طبعا بالنسبة للرايت handed اللي يشتغل بالإيد اليمنى. An imaginary line extend posteriorly from your fingertip in the coronoid notch to the deepest part of the pterygomandibular raphe, as it runs vertically upward toward the maxilla, determining the height of injection. This imaginary line should be parallel to the occlusal plane of the mandibular molar teeth. In most patients, this line lies 6 to 10 mm above the occlusal plane. lies هذا هو هاي النقطة التخيلية هي تقع من 6 إلى 10 ملم above the mandibular posterior teeth وفي وسط الريمس نقدر نقول. Anterior-posterior site of injection. The needle penetration occurs at an intersection of 2 points. Point 1 falls along the horizontal line from the coronoid notch to the deepest part of pterygomandibular raphe اللي هذا ذكرناه بالنقطة الأولى. Point 2 is a vertical line through point 1 about 3/4 of the distance from the anterior border of ramus, and this determines the anterior-posterior position of the injection. Penetration depth, which is the third parameter. Bone should be contacted. هاي نقطة جدا جدا مهمة. The bone should be contacted. Slowly advance the needle until you can feel it meeting the bony resistant, which is about من 20 إلى 25 ملم. التكنيك. The finger on the coronoid notch is used to pull the tissues laterally, stretching them over the injection site. In adult, a 25 gauge long needle is preferred, and 27 gauge and should be long is acceptable. This is due to the depth of penetration that may be required. Patient's mouth is opened widely. The ramus is held between the operator's thumb and index finger. The index or middle finger is placed extraorally on the posterior aspect of ramus at the same height as the thumb. In the adult, mandible. The mandibular foramen is often approximately halfway between the operator's thumb and the index finger and about halfway up the thumbnail. The syringe is introduced across the premolars of the opposite side, aiming to enter the mucosa at the level of halfway up the operator's thumbnail. ها هي الطريقة of giving هذا الكلام اللي شرحته هو بالضبط واضح بهاي الصورة. الإبهام على anterior border of ramus or coronoid notch والother two fingers اللي هو الميدل والindex holding the posterior aspect of the or posterior border of ramus of mandible. هاي هي pterygomandibular raphe وهذا هو البوزيشن of entrance of the needle تدخلها opposite from in a direction between the three molars of the opposite side. الدepth of penetration دائما من 20 إلى 25. من توصل to the hub of the needle معناها أنت فايت غلط أحيانا. The point of entry is midway between the internal oblique ridge, which was palpated by the thumb, and the pterygomandibular raphe, which is visualized. The needle is advanced through the tissue until bony contact is made. In adults, this normally occurs between 20 إلى 25 mm of penetration. When the needle has contacted bone in the correct position, it is withdrawn slightly. Aspiration is performed until 1.5 milliliter of solution is deposited slowly over a minimum of 60 seconds. Aspiration is important. من الممكن تدخل الفزل بهالمكانات هاي لذلك aspiration is required. This injection anesthetises the inferior alveolar nerve and may block the transmission in the lingual nerve. When the lingual nerve anesthesia is definitely required, a modification to the technique is added. Following injection at the original site, the needle is withdrawn halfway through the mucosa, aspiration is performed, and the solution deposited at this point. The injection continues as the needle is completely withdrawn, stopping just as the needle exits from the mucosa to prevent local anesthetic spilling into the mouth. يعني من تريد تخدر اللينجوال نيرف انت سويت كونتاكت للبون واثناء الويذدرو مال الانجكشن مالته you still continue to deposit the local anesthetic solution حتى تخدر اللينجوال نيرف. ها هي الصور التوضيحية لإعطاء الانفيريور alveolar نيرف بلوك. وهاي الصورة شو قلنا لكم one of the parameters إنه النيدل تدخل vertically away from the posterior mandibular molars in a vertical line طبعا. If bony contact is made too soon, then the area contacted is probably the internal oblique ridge. إذا أنت يعني رأسا ضخيت البون معناه أنت ما ماشي على البارامترز بصورة صحيحة وبالتالي أنت you hit the internal oblique ridge of the mandible. Deposition of the solution here will not anesthetize the inferior alveolar nerve. And if bone is not palpated, then it is possible that the needle is placed too far posteriorly. This can result in the needle entering the parotid gland. Injection into this gland can produce loss of transmission in the motor fibers of facial nerve, and this is temporary. But however, this temporary اللي هو يسوي له facial palsy, but it is embarrassing problem شوية محرجة ويا المراجع. فأنت النيدل نوبات تدخلها إذا سوت كونتاكت البون تو سون أنت ضربت الانترنال اوبليك ريج، وإذا راحت بعيدة وتشوف النيدل دخلت وماكو طخة للبون معناه أنت صرت behind the posterior border of the ramus. وهاي الصور توضح النيدل إذا ضربت البون too soon or not hit the bone. Over insertion with no contact of bone, the needle is usually posterior, يعني صارت behind posterior border of ramus of mandible. هذا الدايركت تكنيك اللي سميناه الهالستد تكنيك. The indirect technique, this modification of inferior alveolar nerve block is useful in overcoming the problem of contacting bone too soon, as might happen with the direct method. And as with the direct technique, the patient has the mouth widely open and the operator holds the patient's mandible in a manner described previously. This time, the needle is introduced across the occlusal plane of the mandibular teeth on the same side of the injection to be anesthetized. The needle penetrates the same point in the mucosa as described previously, and after the needle has been inserted about a centimeter, the syringe is swung across to the premolars of the opposite side. يعني أنت تدخل النيدل same البارامتر إنه أنت 6 إلى 10 مليمتر vertically above posterior mandibular teeth، تدخلها هنا. الفكرة إنه النيدل تدخل in the same side to be anesthetized. تدخل النيدل حدود سنتيمتر واحد، بعدين تفر النيدل to the opposite side، تجيبها هنا opposite side of the two premolar teeth. And the injection then continues as described above in the direct method. بعدين تدخل النيدل أكثر إلى أن نسوي contact البون. As this method involves more movement of the syringe than the direct technique, the later method is preferred as the first choice. The later method، هاي الطريقة is preferred as the first choice، لأن نوبات يعني تجنبك هاي الطريقة نوبات بيها تقدير حسابي أكثر. يعني أنت تعرف دخلت نص النيدل بعدين تفرها منها وتكمل للكونتاكت أوف بون. نوبات الحل السمان أو العدم فاتي تشي هواية يضيع لك الدخولية مال النيدل in the direct technique. Problems associated with inferior alveolar nerve block anesthesia. The inferior alveolar nerve block is not successful in 100% of the cases. سبب poor technique and ectopic mandibular foramen. This foramen is not in the same position in every patient. من ممكن أحيانا عندنا two mandibular foramen. The position varies with age. In young patients, the foramen may be below the occlusal plane. In adults, is usually above the occlusal plane. Bending of the needle during administration. Dental local anesthetic needles are not rigid structures and may be deflected during the advancement through the tissues. Thus, the needle may not reach the intended target area. Accessory nerve supply. The inferior alveolar nerve block may not provide satisfactory anesthesia owing to the fact that the nerves other than the inferior alveolar nerve can provide innervation to the pulps of the mandibular teeth. من الممكن المايلوهايد nerve أيضا يعطي innervation pulps of the mandibular teeth. اللونج buccal nerve أحيانا يعطي innervation mandibular teeth. فيجي لك accessory nerve supply من lingual nerve, long buccal, mylohyoid, أحيانا من auriculotemporal nerve والupper cervical nerves. هذا كان شرح لكيفية إعطاء inferior alveolar nerve block. الآن أريد أعطي long buccal nerve anesthesia. The area of insertion is the mucous membrane distal and buccal to the most distal molar tooth in the arch. The target area هي الbuccal nerve as it passes over the anterior border of ramus of mandible. The depth of penetration حدود 2 إلى 4 ملم وكلش كافية 2 ملم depth. A syringe alignment parallel to the occlusal plane on the side of injection, buccal to it, and distal to the last molar tooth. The long buccal nerve may be anesthetized at various points along its length. ممكن مو إلا طريقة شوية تتقدم لي قدام. يعني مو إلا at the anterior border of ramus تقدر نهاية تعطي الانستيزيا مالتك. This may be performed in a zone from the depth of the mandibular buccal sulcus to the occlusal plane level in the buccal mucosa. A true long buccal block can be performed by depositing a solution at the anterior aspect of mandibular ramus, which is the best method. The coronoid notch is palpated and the needle is inserted at this point until bony contact is made. The needle is withdrawn slightly, aspiration performed, and 0.3 to 0.5 milliliter of solution is injected slowly. In some patients, an anastomosis exists between the long buccal nerve and the inferior alveolar nerve, and the former nerve may be sent accessory supply to the pulps of the teeth via retromolar foramen. اكو foramen احيانا بالرج behind the last molar tooth. فنوبات اللونج بكال هم يعطي انستيزيا الى البلبس of mandibular teeth. فلذلك لا بأس انت تعطي inferior alveolar nerve block، واحيانا اذا المراجع ظل يتألم تعطي لللونج بكال. هذا غطينا اللونج بكال نيرف بلوك والانفيريور الفيولار نيرف بلوك. التكنيك الآخر for mandibular anesthesia هو Go Gates mandibular nerve block. This method is one of the high methods of anesthetizing the inferior alveolar nerve. The advantage of this method is that it can block transmission in many accessory supplies to the dental pulps, including that provided by the lingual nerve, long buccal nerve, mylohyoid, and the auriculotemporal nerve. The aim is to deposit the solution at the mandibular condyle. فإذا الانفيريور alveolar nerve وين كان الأيم؟ بالmandibular foramen. هنا الأيم at the mandibular condyle. And there is evidence that this technique is more successful than the conventional inferior alveolar nerve block, and that there is less likelihood of intravascular injection. ولهذا يعتبروها high level of anesthesia or high methods of anesthetizing the mandibular nerve or anesthetizing the inferior alveolar nerve. The nerves to be anesthetized هو الانفيريور alveolar nerve, mental, incisive, lingual, mylohyoid, auriculotemporal والbuccal in 75% of patients. The area of anesthesia, mandibular teeth to the midline, buccal, mucoperiosteum, mucous membrane on the side of injection, anterior 2/3 of the tongue and the floor of the oral cavity, lingual soft tissue and periosteum, body of mandible, inferior portion of ramus, and the skin over the zygoma, posterior portion of the cheek and temporal regions. التكنيك احنا قلنا الهدف وين هنا؟ الكوندايل. The patient's mouth opened widely. The syringe is introduced into the mouth parallel to the plane, running from the angle of the mouth to the intertracheal notch area of the ear اللي هو هذا اللاين. من هذا تتخيل فد imaginary line من الكورنر إلى ال intertracheal notch of the ear. Across the opposite maxillary canine, the syringe is then directed across the palatal cusp of the maxillary second molar on the side receiving the injection and enters the mucosa at a point much higher than that penetrating during the standard Halsted approach. The needle is advanced through the mucosa until bony contact is made on the condyle, withdrawn slightly, and after aspiration, the contents of the cartridge are deposited. The average depth of penetration is about 25 mm. The patient maintains the mouth in the open position for a few minutes. When initially described, it was recommended that 3 mm of solution was used, and thus a second injection may be required. Experience with the go-gate mandibular nerve block shows that 1.8 ml is usually adequate to provide clinically acceptable anesthesia in virtually all cases. فإذا الهدف من الجو-gate تكنيك هو الكوندايل. الانترا اورال لاند ماركس اللي قلناها عندنا اللاين من الكورنر اوف ماوث الى الانترتريجل اريا، الباليتال كاسب اوف ماكسيلري سكند مولر، والماكسيلري كاناين اون ذا اوبوزيت سايد. ها هي النقاط اللي احتاجها حتى ادخل الى السوفت تيشيو وتارجتينج الكوندايل. الاريا of insertion mucous membrane on the mesial of the mandibular ramus on a line from the intertracheal notch to the corner of mouth just distal to the maxillary second molar. Target area lateral side of the condyle or the neck of the condyle just below the insertion of lateral pterygoid muscle. فاحنا هنا عندنا المانديبولار فورامين. الهدف بالطريقة الأولى اللي حكيناها الانفيريور فيولار نيرف بلوك. أما هنا الكوندايل هي الهدف من الجو جيتس تكنيك. Once the patient closes even slightly, two negatives occur. The thickness of soft tissue increases and the condyle moves in a distal direction. Both of these make it more difficult to locate the condylar neck with the needle. طبعا إذا ما يفتح حلقة المراجع حتيه عليك الحسبة. أول شيء السوفت تيشيو حيضيع عليك اللاند مارك على الكوندايل. أحيانا الكوندايل you can detected إذا البيشنت opens his mouth widely. زين. الكوندايل من يسد المراجع الكوندايل حيروح ديستالي فما تقدر توجده بهالحالة. Go-get technique is a true mandibular nerve block because it provides sensory anesthesia to virtually the entire distribution of V3 اللي هو المانديبولار branch. The inferior alveolar nerve, lingual, mylohyoid, mental, incisive, and auriculotemporal, and the buccal nerves all will be blocked by the go-gate injection. Significant advantages of go-gate technique over the inferior alveolar nerve block include higher success rate, lower incidence of positive aspiration, and the absence of problems with accessory sensory innervation of the mandibular teeth. لأن كله الترنك كله حيخدره، فبعد من شنو خايف يعني؟ يجي له من اللينجوال انت مخدر، يجي له من auriculotemporal accessory مخدر، يجي له من mylohyoid مخدر. The time of onset of anesthesia is somewhat longer, 5 minutes, than the inferior nerve block, which tends to be about 3 minutes, primarily because of the size of the nerve trunk being anesthetized and the distance of the nerve trunk from the deposition site, approximately 5 إلى 10 ملم. الكومبليكيشن ممكن تصاحب الجوجيت تكنيك هيماتوما، تريزموس، temporary paralysis of cranial nerve. من الممكن يصعد السوليوشن through foramen ovale أو spinosum إلى الأوكيولوموتور، التروكلير or even الابديوسنت nerve. Case of cranial nerve paralysis after a right gogate mandibular nerve block: diplopia ازدواجية بالنظر، right sided blepharotosis شوية تهطل عينه، and complete paralysis of the right eye persisted for 20 minutes after the injection. من ينتهي البيريود of injection تنحل المشكلة هاي كليتها. This has occurred after an accidental rapid intravenous administration of local anesthetic. The recommendation of Dr. Gogate include placing the needle on the lateral side of anterior surface of the condyle, aspirating carefully, and depositing slowly. If bone is not contacted, anesthetic solution should not be administered. هاي هي النقطة المهمة. If bone is not contacted, so the anesthesia should not be administered. التكنيك الثالث اللي يفيدنا وهو مهم جدا في الانستيزيا اوف ماندبل هو الاكينوزي فازيراني بلوك اللي يسموه closed mouth mandibular block. This is another high block injection. It is often referred to as the Akinosi technique. As was the case with the Go-Gate technique, it may be anesthetize the accessory supply to the dental pulps from the lingual, long buccal, and mylohyoid nerves. It has no bony end point, so the depth of soft tissue penetration is somewhat arbitrary. ماكو هنا bony contact بالأكينوزي. Akinosi recommended a penetration depth of 25 mm in the average sized adult, measuring from the maxillary tuberosity. Is administered with the patient's mouth closed. It can achieve anesthesia of inferior nerve in cases where access to a normal approach is difficult due to trismus or because of large or uncontrollable tongue. تضطر أحيانا تستعمل الأكينوزي من واحد لسانه كبير كلش يزعجك هذا بالإنجكشن، أو trismus, he cannot open his mouth widely. Lower aspiration rate with that of the inferior nerve block. أحيانا يسمى tuberosity technique، وممكن أحيانا يستعمل extra oral approach through the sigmoid notch. The area of insertion هو soft tissue overlying the medial border of mandibular ramus directly adjacent to the maxillary tuberosity at the height of the mucogingival junction adjacent to the maxillary third molar. The target area هو soft tissue on the medial border or medial side of ramus in the region of the inferior alveolar nerve, lingual, mylohyoid, as they run inferiorly from foramen ovale toward the mandibular foramen. The technique: place your left index finger or thumb on the coronoid notch, reflecting the tissues on the medial aspect of the ramus laterally. Reflecting the soft tissue aids in visualizing the injection site and decreases trauma during needle insertion. Ask the patient to occlude gently. بالعكس هنا تطلب المراجع انه يسد حلقه شويه. Ask the patient to occlude gently with the cheeks and muscles of mastication relaxed. Reflect the soft tissue on the medial border of ramus laterally. The barrel of the syringe is held parallel to the maxillary occlusal plane, with the needle at the level of the mucogingival junction of the maxillary third molar or second molar. Advance the needle about 25 mm in tissues. This distance is measured from the maxillary tuberosity. The tip of the needle should lie in the mid portion of pterygomandibular space close to the branches of mandibular nerve. هاي هي الطريقة اللي نطي بها الأكينوزي تكنيك، وهذا هو ال depth of insertion of our needle. الأكينوزي closed mouth mandibular nerve block. The barrel of the syringe is held parallel to the maxillary occlusal plane على العكس من الهالستيك تكنيك. السرنج parallel to the occlusal plane of the mandibular posterior teeth, with the needle at the level of mucogingival junction of second or third maxillary molar, and advance the needle posteriorly into the tissues on the medial side of mandibular ramus. هذا هو الأكينوزي تكنيك. Orientation of the Buccal orientation in closed mouth mandibular block is very important. The Buccal must be oriented away from the bone of mandibular ramus. Deposition about 0.5 إلى كل الكاربولة نعطيها in 60 seconds. Motor nerve paralysis develops as more quickly than sensory anesthesia. The patient with trismus begins to notice increased ability to open the jaw shortly after the deposition of anesthesia. هذا هو التكنيك for أكينوزي فازيراني. من الممكن أيضا نعطي other supplemental anesthesia as incisive and mental nerve block. Involves depositing of local anesthetic solution at the mental foramen. The hope is that sufficient solution will enter the foramen to block the transmission in the incisive nerve to anesthesia of premolar teeth and anterior mandibular teeth. As is the case with mandibular foramen, the mental foramen is not a constant position, although it can be visualized in the peripheral radiograph. Unfortunately, it is not always apparent in the panoramic radiographs. This injection is useful in providing soft tissue anesthesia, as the mental nerve is readily accessible in the soft tissue. The amount entering the foramen to anesthetize the incisive branch must vary. The patient has the mouth partly open and the needle is inserted through the reflected mucosa, aiming for bone in the region between the two premolar apices. Once the bone is contacted, the needle is withdrawn slightly and aspiration is performed, and 1.5 ml of solution is deposited slowly. Massaging the tissues following injection may encourage entry of the solution into mental foramen. هاي الغاية mental nerve block والincisive nerve block أيضا هي الهدف مالتك إنه تصل إلى المنتال foramen or the bone surrounding المنتال foramen. لذلك أنت you have to contact the bone. الهدف إنه أنت تنزل solution وهذا solution will enter through this foramen فحيطلك بلوك للمنتال nerve plus الincisive nerve. Positive aspiration حدود 5%. الarea of insertion هو mucobuccal fold or just anterior to the mental foramen. الtarget area هو mental nerve as it exits the mental foramen. usually located between the two apices of the first and second premolars. The mental foramen usually found around the apex of the second molar. However, it may be found anterior or posterior to this site. Advance the needle slowly until foramen is reached. The depth of penetration is about 5 to 6 mm. For the mental nerve block to be successful, there is no need to enter mental foramen or to contact bone. هذا for the mental nerve block. انه انت ماكو حاجة، انت بس مجرد estimation للposition of mental foramen تقدر تخدر المنتال نيرف، لكن للانسيزيف يفضل تسوي كونتاكت للبون. For incisive nerve, advance the needle slowly until mental foramen is reached. The depth of penetration is 5 to 6 mm. There is no need to enter mental foramen for incisive nerve block to be successful. نتوقف هنا إلى Supplementary Anesthesia، وباكر إن شاء الله نتشاوف على بالميتينج يعني يوم الأحد إن شاء الله ونتناقش بالموضوع. شكرا جزيلا وبارك الله بكم.